Today we're going to be talking about administering medications intravenously. So it's important to remember that the intravenous route is one of the most dangerous, or is the most dangerous way to give medications. This is giving medications directly into the bloodstream. So it has an almost immediate effect. It's often used in most emergency situations just because it has that immediate effect. And again, it is the most dangerous route of administration because it cannot be recalled and actions cannot be slowed. Now, there are certain medications that do have anecdotes. So anecdotes can be given after a certain medication is given to negate the effects of it. So, for example, morphine has an anecdote. It's called Narcan. So not all IV medications have anecdotes, but it's very, very important to know which ones do and what they are. So if we had given morphine, we know that it has a sedative effect. It can cause someone to be over-sedated where we're worried about their breathing and then protecting their airway. So if something like that happened, we could give them Narcan and it would negate the effects of the morphine. And also with IV medications, some complications that could happen is that there is an increased risk for infection. So since we are giving something directly into the bloodstream, we don't want to introduce any microorganisms, any bacteria, anything like that. So that's why it's very, very important that we maintain aseptic technique, and we're going to talk about how to do that when giving IV medications. There is also the risk of an air embolism. So we know embolism is usually a clot that travels throughout the body, can cause a stroke, can cause pulmonary embolism. So this is just in the form of air. So we have to be very careful to not introduce air into the bloodstream to cause any adverse effects associated with an air embolism. Okay, so for different types of intravenous solutions, so we're just going to kind of talk about the tonicity of different solutions. You don't really have to memorize all of these right now. This is just kind of to, just kind of be a brief overview so you kind of just get the understanding of this. So we know a lot of times IV solutions are ordered, and this is just either to hydrate the patient, or it can be just administered at a slow rate. And this is usually called KVO, or keep vein open. It's just to kind of help keep the IV patent and help push through any medications that the patient might be getting through that IV. But there are different types of IV solutions. This is considered a medication. It's ordered by the doctor. So the doctor will decide which solution the patient is going to be getting. But it's important to know the effects of the different solutions and how to give them safely. So it's important to note the type, the amount, and the sterility of the fluid. So the type, we're going to talk about some different types. The sterility of the fluid, this is just basically us taking out the whatever ordered fluid is, looking at the bag, making sure it's not punctured in any way, that we are maintaining sterility once we're, spiking the bag and doing things like that. And we also want to make sure that it's not expired and there's not any particles or sediment floating within the fluid. So various types of fluid. So one type of fluid is isotonic fluid. The example of this is your normal saline or your 0.9% sodium chloride and your lactated ringers. So this is isotonic, so it just means that it has the same number of solutes that the cell components have. So it doesn't cause any fluid movement into or out of the cell. So it's most like the cell components. So this is usually just for hydration. So then we have hypotonic solutions. So an example of this would be 0.45% sodium chloride or half normal saline. So with hypotonic solutions, these solutions have fewer solutes than the cell components and results in fluid moving into the cell. And then our hypertonic, an example of this would be our 10 to 15% dextrose and 3% sodium chloride. So these are hypertonic. So hypertonic solution has more solutes that are present within the cell and results in fluid movement out of the cell. So again, tonicity is just the solution's ability to make water move in or out of the cells. It includes isotonic, hypotonic, and hypertonic solutions. Just again, you just need to know the basic concepts of this. This is not really going to be on your test. You'll learn more about these and when they're indicated during your fluid and electrolytes lecture. But as far as the responsibility of the nurse is responsible for initiating the IV solution, monitoring, and then discontinuing the IV solution when you have an order to do so. And then this is just a chart that's in your ebook. It just kind of goes into more depth on the different kinds of solutions. You can just use this as a reference. Okay. So medications via IV solution. So these are medications, or some medications can be given through our IV solution, meaning we have our normal saline ordered. We can add a certain medication to that if ordered. This is not as commonly done anymore just because it's really easy to cause error because it's not labeled. It looks like it's just normal saline or lactated ringers, whatever the solution might be. You also have to make sure that whatever medication you're inserting into the solution is compatible. So this is not necessarily done anymore, but if it is done, you have to make sure it's labeled and the top and the amount of medication is put on there. It's important to put that on just our normal saline or our regular IV fluids. We still need to label them and note that there is nothing added to them. So for this, if it's given by infusion, the patient receives it slowly over a relatively long period. And with any of our IV medications, we want to make sure that we monitor at least every hour to make sure the patient's not having a reaction to the medication and that their IV site is still good. Okay, so before we are getting ready to administer any IV medications or IV solutions, it's important to do, basically what we've talked about in the previous lecture about safe medication administration. We want to make sure we look up the medication or the solution and the actions. So we want to know how it's supposed to act in the body. Any special nursing considerations, this includes the rate of administration. So all IV medications, whether they are given over a longer period of time through an IV pump or they're like an IV push medication, most of them have a prescribed rate that they're supposed to be safely given by. We want to make sure that we know the safe dosage. And then the purpose of the administration. So why are we giving this? Are we giving it to help prevent clotting? Are we giving it to fight an infection? And then we also want to know any adverse effects of these certain medications. Okay. Then we also need to assess compatibility of the ordered medications, diluent, and infusing IV fluid. The diluent is something that you will use when giving IV push medications if they need to be diluted. So you have to make sure that that's compatible as well. So most facilities have some kind of software or reference software that you can use to check IV compatibility. So if you have two medications or medication in solution running in the same IV site, it's very important line or site, it's very important to make sure that they are compatible. If they are not compatible, they can cause a chemical reaction. This can cause to change kind of like the form of the medication. It can also cause one medication to be less effective than the other. So it's very important to check compatibility before you give any IVs in any medications through the same line. Then we always want to assess the IV site for presence of complications. So anytime we go in the room, someone's on IV medications, or we're starting a new IV medications, or we're about to give an IV push, we need to always check the site for presence of complications. We'll talk more about these in your IV complication lecture, but we want to make sure that it's not red or puffy, swollen around the site, to make sure that the patient gets the medication and that it goes into the vein and not into the tissue surrounding it. And then, of course, we want to always assess allergies before we give any medications. And then hand hygiene, of course. We're going to make sure we select the proper medication from the supply system or medication drawer. Compare the label with the medication administration record. So that's our second check there. Check expiration dates and clarity of the solution. So we want to make sure the solution's not expired, because this can mean that it's no longer sterile. We also want to make sure that the solution is clear and doesn't have any particles or anything floating in it. And then if needed, we want to make sure we perform our dosage calculations and then identify the patient and check ID band. And then we would check the medication again before giving it. Okay. So another way that we can give IV medications is by an IV bolus or IV push. So some medications are more concentrated, and they just involve a single injection of the concentrated solution, and this goes right into your IV line. You can see in this picture here, it looks like they don't have the little one-way valve like we normally use, and then you're able just to screw this the syringe on with that. It looks like maybe they're using a needle here, but more often than not, we will use a needleless device and just do it that way. The administration rate varies per drug, so this is something you want to look up before. You can consult a pharmacist or drug reference to confirm the exact administration times. So remember, your pharmacists are really, really good references for you. So you can call them if you have any questions about the safety of a medication or anything at all, and they're a really great reference for you. So whenever you are giving an IV medication, we are going to either give it directly into the into like the needleless port if they're not hooked up to IV fluids. If they are hooked up to IV fluids, you're going to find the port that's closest to the site of the IV to give the medication through. You don't want to give it through a port that's way high up, and then it takes forever to get that medication to the patient. So that's why we choose the closest port. So this method, it's used to rapidly treat symptoms. It can be used in life-threatening situations because it can be quickly given and it can quickly achieve therapeutic levels of the medication. Another thing that it's important for the nurse to determine before giving this medication is if the medication needs to be diluted. So we know for the IV push, this is a more concentrated form of an IV medication. Some of them do require to be diluted, not all of them. But for example, Ativan is one medication that it is required to be diluted. You can look at your drug reference guide to help you know how much to dilute with. And then again, we also want to make sure we always look up how slowly to push the medication. If you push a medication too fast, it could cause some serious complications. So please make sure you know that once you get to clinical, your instructor is going to want to know that you've looked up how to give all of your IV medications. So that means you know if it needs to be diluted, you know how fast it needs to be pushed, and you know your adverse effects, you know your therapeutic reason for giving, all of those things. So that's something that you need to check and that your clinical instructor is going to be looking for. So supplies needed for this is you need to have antimicrobial swabs. These are your alcohol swabs, your CHG swabs that are available at the facility. You'll also need to watch with the second hand in order to make sure that you're administering at the appropriate rate. Gloves, we're using universal precautions because we could come in contact with blood or bodily fluids. The prescribed medication, you want to make sure you have the appropriate syringe and appropriate needle for withdrawing medication from a vial or an ampule. So remember, we need to use a filter needle to withdraw the medication. We also need to have some saline flushes. Typically, these are 10 milliliters saline flushes. I always grab at least 2 because we want to be able to flush before we give the medication to make sure the IV site is good and patent. And then we also want to flush after we give the medication to make sure that the patient gets all of the medication. Okay, so when you are actually about to give an IV push, you need to do a few things first. So we've gathered all of our supplies, we've prepared our medication appropriately, we know how fast to give it. Okay, we've done our 3 checks, we've scanned it once we've got into the patient room. If the patient is getting an infusion per the pump, you want to just pause the pump, whether it's compatible or not, because it'll beep you just because it can feel that increased pressure in the line. So it's best just to pause it. If the IV push is not compatible with whatever medication or solution is running, then you definitely want to make sure you always flush before the medication and after the medication, which you should be doing that anyways, but that's going to help prevent any chemical reaction from occurring from those two solutions coming into contact. So again, we're going to use the closest port to the patient. So you can see down in this picture, you can see that port that's on the primary line there. They're using that one. So they will have cleaned with their antimicrobial swab for the appropriate amount of time. And then they will flush to check the line, flush the medication at the appropriate rate, and then flush again after. And then you can unclamp the administration set above the injection port and restart the infusion pump if necessary. So you can see how the nurse down here, they've got the IV tubing just kinked. That's just to help prevent any backflow of that medication as they're flushing it. Okay, so we can also give medications via intermittent intravenous infusion. Oftentimes, these are called our piggyback medications. You'll see a lot of antibiotics given this way. For example, we have a picture of Zosyn here. This is a very common broad spectrum antibiotic that you will be giving a lot. So there's all sorts of different medications that are given this way. So it's important that we know how to give them. So this is just a medication that's given in a small amount of IV solution and is administered over a short period at the prescribed interval. So this is when we're going to use a pump. So it's different than our IV push. So it comes in a bag. So we've got 3.375 grams and 50 mils. So it's a small amount of IV solution. So these do, even though we're using a pump, these do require the nurse to program the rate into the pump. It can be administered by gravity, and we are going to kind of talk about how you do that. But more often than not, you are going to have a pump. That's really the safest way to do it. So we're going to focus more on that. But if you do give by gravity, it requires the nurse to calculate the infusion rate and drops per minute. And we'll talk about that. Okay, so different devices that can be used to give IV piggybacks and IV solutions. Um, so piggyback setup, we're going to talk about this. A volume controlled administration set and a mini infusion pump. You may all see these used. Okay, so the most common one you're going to see is the IV pump. So this is the suggested best practice. It allows for more flexibility. So when talking about IV pumps, you have a primary line and a secondary line, okay? So in this picture, you can see on the pump that the A line is pumping and it's got normal saline going. That is considered our primary line. Our B line is considered our secondary line, and this one, it has dopamine running. So you can either have them running concurrently, meaning the normal saline or the fluid and the medication are running at the same time, or you can have them running as a piggyback, meaning that primary line is paused while the piggyback runs. So this is normally just done when you have a piggyback medication that's given over, like 15 to 4-hour time period. It just depends on the medication. But we can run those either way. Okay, and this is a picture of the piggyback setup. So this would be not using a pump. This would be done by gravity. So the intermittent or additive solution is considered the secondary. It's placed higher than the primary solution. So we're trying to run in our secondary bag, so we will hang our primary bag lower. So our secondary tubing comes with an extension hook, and this is what's used to lower the primary IV solution. And then the port on the primary line has a back check valve. You can see in this picture, and that just helps prevent the fluid from backing up. So it helps to prevent the secondary solution or the piggyback solution from backing up into that primary line. So again, this would be done by gravity. And there is a video on Canvas that's from someone on YouTube, and they are taking you step by step through this, how to set up a piggyback setup using gravity. So I encourage you to watch that. These are just kind of the concepts behind it, but it's hard to just discuss this without doing it. Okay, so anytime we are giving IV medications, we always need to know the flow rate. So this is how we know how fast to give the IV medication, and it also tells us how to program the pump. So a lot of times within the chart, it'll have the mils per hour, but sometimes we'll have to calculate it, and it's very important that you remember how to do this. I know you've probably talked about it in your dosage calculations class, okay? So anytime you hear flow rate, that means your milliliters per hour, okay? So the formula is down below, so it's just your volume in milliliters over your time in hours. So for example, say we have 50 milliliters of normal saline to go over 2 hours. 50 divided by 2 is 25 mils per hour. So that's our flow rate, and that's what we would set our pump at. This is just another way of giving IV medications that you might see. This is a volume control administration set. So it's used for infusion solutions for children, critically ill, and older adults when the volume of the fluid to be infused is a concern. So if we're trying to be very, very careful with how much fluid our patient is getting, we can kind of control the amount that they're getting by putting it within the little cylinder here and closing that clamp so no more IV solution goes through it. We just have more control on the amount of fluid that the patient's getting. So that's just something you might see just to kind of be aware of. And then also a mini infusion pump is something you might see. So this is a little pump that you can actually put a syringe on, and it will administer it at the prescribed rate that you set on there. this a lot of times is again given in pediatrics, those who, we have to really limit the amount of fluid or medication that they're getting. Okay, so for giving intermittent IV piggybacks, supplies needed. Again, we want to make sure we have antimicrobial swabs, a watch with a second hand, disposable gloves, prescribed medication prepared and labeled in the small volume bag, an infusion pump, short secondary infusion tubing, so that's for our secondary line or our piggybacks, metal or plastic hook, an IV pole, and a date label for the tubing. So this is the date label for the tubing. Every facility is a little bit different. I know at St. Bernard's, they want their tubing to be changed, their standard tubing to be changed every 96 hours. So they'll be labeled like for the date that it needs to be changed. So they have like days of the week stickers. So it'll put like needs to be changed on Monday or whatever. So that way the nurse who has them on Monday knows that their IV tubing needs to be changed. Okay. So for administering medications by piggyback intermittent intravenous infusion, first we have to prepare that medication. So we're going to get our secondary tubing. Anytime we get our IV tubing out, getting ready to spike it, we always want to clamp first. So we're going to clamp our IV solution, and then we're going to attach the infusion tubing to the medication. So we want to be very, very careful that we maintain aseptic technique. Now, we don't have to have gloves on during this time, but we do want to make sure that anything on the inside of the bag, the spike of the IV tubing, the ends of the IV tubing, those are all being kept sterile. So we have to be very careful with that. So if we are giving by gravity, we want to make sure we hang the piggyback container on the IV pole higher than the primary IV. So that's when we would use that little plastic or metal hook to hang the primary bag lower. Again, we're going to label the tubing with the current date or however the facility does it. We're going to squeeze the drip chamber or administration tubing and release. We're going to fill the chamber to about half full and then prime the remainder of the line. There is the backfill method that can be used. Again, refer to the video that is within Canvas. This is going to break it down and make more sense to you. Again, we're going to use our antimicrobial swab to scrub the access port on the primary line, and then connect the piggyback to the access port. Then we can open the clamp on the secondary infusion tubing, set the rate for the secondary infusion on the infusion pump, and begin infusion. So we would be doing our line B, making sure we're programming all of that in right. If we're using gravity, we would use the roller clamp on the primary infusion tubing to regulate the flow of the prescribed delivery rate. Then we're going to clamp the tubing on the piggyback set once the solution is infused, and we can raise the primary IV fluid container back to the original height. Okay, so we are just going to briefly discuss the backfill method for the gravity infusion. So you can, like we talked about on the previous slide, you can prime the secondary line just like you would prime the primary line and then hook it up. If you are using gravity, you can use a backfill method. It's just an alternative way to prime the secondary tubing. So you would attach the medication bag to the secondary infusion tubing. So you wouldn't prime first in this situation. Then you would lower the medication bag below the primary IV solution, open the clamp on the secondary infusion tubing. And then you would this would cause the solution from the primary bag to enter the drip chamber until the drip chamber is half full. So this is just another way to prime. Then you could close the clamp on the secondary tubing and hang the medication container on the pole, and then proceed with the administration by lowering the primary IV container. Okay, So another is just tidbit that you need to know if you are giving medications per gravity infusion. Now, again, I just want to reiterate that this is probably, I have never really had to do this in my time as a nurse. The only time that you would probably have to do this would be if for some reason you don't have enough IV pumps. So you had to do it this way. So it is important to know how to do it. But this is not going to be the method that you use the most. Okay. So if we are having to give something by gravity, you want to make sure that you have your tubing for your secondary infusion set and that it has a roller clamp, because this is what's going to be used to help regulate the flow rate or your drip rate. Okay. So if you're giving it by IV, by gravity, then you have to be able to regulate your drop rate. Okay. So first and foremost, you have to have your secondary tubing, because this is going to tell you what your drop factor is. And you have to have your drop factor in order to calculate your drip rate. So we have our flow rate that's in mils per hour, but we're not going to stand there for an hour and count our mils. So we need to do our drops. So the drop factor is on our secondary tubing package. Okay. So if it is a macro drip set, which is the most common, okay, this is going to be either your 10 drops per mils, 15 drops per mils, or 20 drops per mils. So this is your drop factor is how many mils or how many drops are in 1 mil. And then if you have a micro drip set, it is always 60 drops per mil. Okay. All right, so the administration set, this plays an important role in the amount of fluid the client receives. So again, with the macro drip ones, this varies in drops per mil. So it can be, 10 or 15. And then your micro drip, it's always going to be 60 drops per mil. So there's a lot more little drops in 1 mil, so that's why it's called a micro drip. Okay, so of course we have to be able to calculate our drip rates. So again, we have our micro drips, our macro drips listed up there. We find this on the secondary IV tubing packages. That's our drop factor. Okay, so we have to know that in order to calculate. So we need to know the drops per minute. So this is the prescribed infusion rate and the flow rate of the administration set. Okay, so in order to do this, we need to multiply the hourly rate, so number of mils to be infused in 60 minutes, by the drop factor in drops per milliliters to obtain the total drops per hours. Okay, so we get it in drops per hours first. Then we divide by 60 to get the drip rate in drops per minute. All right. For example, an hourly rate of 100 mils multiplied by 15 drops per milliliters and divided by 60 equals the drip rate. So therefore, the drip rate equals 25 drops per minute. So ultimately, we're trying to get our drip rate, which is drops per minute. Okay. So flow rate is mils per hour. Drip rate is drops per minute. Okay. So you can use this formula here listed. So the hourly rate in mils times the drop factor, which is your drops per mils, divided by 60 minutes will give you your drip rate or your drops per minute. So this is just a practice one. So how do you calculate the IV rate for drops per minute? So you have your order, so infuse 500 mils of D5W over the next 12 hours. And then we're going to use a micro tubing. So what is the drop per minute rate? So I'm going to pause the video you can pause the video for a minute and try and figure it out, and then we'll go over it whenever you come back. Okay, so how to set this up is we first need to get our hourly rate in meals, so that's our meals per hour, so that we would take 500 and divide it by 12 hours, and you should get 41.66 repeating. And then we are going to multiply that by 60 because that's our drop factor. So we have micro drip tubing. So our drop factor is 60 drops per mils. So we're going to multiply that. And then we're going to divide it by 60 minutes to get it in drops per minute. So then we would get our drip rate, which would be 41.66 repeating. Okay, so another thing to note is that there is an infusion lock or a J-loop. We talked a little bit about this in the IV lecture. This is usually put on the end of the hub of the IV, and it's got a one-way valve on the end of it, and this just helps keep the blood from backflowing. It also is what we can use as a needleless port to attach our IV solution, to attach or to give any IV medications through it. So I see most patients with this. It's just easier that way, but it's used for patients who require intermittent intravenous medication or a bolus or a push. And it allows the patient to have more freedom than a continuous IV infusion. So if they don't require IV solutions, they can just have this saline locked, which just means it doesn't have anything hooked up to it at all times. But it is important to keep this patent, so if it doesn't have IV solutions going through it, you need to make sure that you are flushing it at least once a shift to make sure that it's still patent. Okay, so some special considerations would be to do not dilute or reconstitute IV push medications by drawing up the medication into a commercially available pre-filled flush syringe of normal saline. You will see this done, and not all facilities have the little vials of the normal saline or the sterile water, but this is technically not supposed to be done. Label all clinician-prepared syringes or IV push medications or solutions unless you are preparing it at the patient's bedside and are giving it immediately. But especially if you have multiple patients, you have several IV meds, it's going to be very, very crucial that you label the medications, because you might have medications that are all clear, that are all about the same amount in a 3 ml syringe, and if you don't label it, you don't know what's what. So that could cause, a really big med error if you give the wrong patient the wrong medication. If an adverse effect is suspected, you need to notify the patient's primary care provider. Additional intervention is based on type of reaction and assessment of the patient. So if they're having what seems like an anaphylactic reaction, they start getting swelling, itching, maybe having trouble breathing, they might have to get some epinephrine or something like that. If they are getting Narcan and they're too sedated or something like that, they can get Narcan, the antidote. So anyways, otherwise you're just going to treat the symptoms, because most medications you can't reverse or don't have an antidote, so you want to make sure that you know what to do if any of these adverse effects happen. Okay, so for problem solving, you'll hear a lot of beeping with IV pumps. Most of the time it is because it's gotten kinked. So if you hear an IV pump going off, and it says distal occlusion, distal means further away from the pump, so this is likely closest to the patient. If it's a proximal solution, it's something that's kinked typically above where the IV tubing is connected to the pump. So a lot of times that's just the clamp. You may have forgotten to open the roller clamp or something like that. If it's gotten kinked on the patient side, it could just be a position or something like that, or again, maybe some kind of clamp is on there. If it is positional, maybe your patient has an IV in their antecubital region where the bend of their arm is, it's going to beep a lot. So there are different devices to kind of help remind the patient to keep their arm still or straight or whatever, but ideally it's just best not to put IVs there in the first place. And then you also want to make sure that you ensure tight connections, so the medication tubing is all secure, it's not running out, it's actually going to the patient. Okay, and then documentation. You want to make sure that you do this immediately after administration. It should include the date, time, dose, route of administration, site of administration, and rate of administration. So this should be all done when you scan it into your MAR. It'll prompt you to document those things, or it should at least. If not, make sure to document all of those. PRN medications require documentation of the reason for administration. So if it's for pain, you want to make sure that you're giving it for pain and that you've documented that. If it's for nausea, you want to make sure you documented that it was for nausea. And then if the patient's refused or omitted medications, if you hold a medication for whatever reason, maybe you're giving something to lower their blood pressure. Well, their blood pressure is already 80/60. So you're going to hold that medication. You need to document why you held it and that you contacted the doctor. And then sometimes patients do refuse medications, so you want to make sure that you document that the patient refused and they did not get that medication. And again, the patients have the right to refuse as long as you educate them appropriately. If they refuse, you're not going to force that medication on them. And so that is all I have for IV medications.